Good afternoon, everyone. Scott Maybor here with your Medicare Missive from the farm on a Friday afternoon, the 20th of February. Time for a little skiing. Sorry. Let's see. I got off the phone on the way over here. I was talking to a client, friends of mine. He and his sister, and they're trying to help their mother. Mother is in an assisted living facility for memory care. This particular facility has their own Medicare Advantage plan, which they're pushing, and the plan that she was on canceled. So initially, and I think I did a video on this, they got a letter that they kind of thought was bullshit, for lack of a better term, that they didn't believe that it was a real letter that her plan was canceling. And it was canceling. It was a Blue Cross plan. So the letter was legit. She lost her coverage, and basically she has an enrollment period until the end of February to sign up for new coverage. All right, so it's the 20th. We have time. The brother has been sending me, or the son, has been sending me information about the plans that the facility is offering. So this is a United Healthcare plan that's exclusive to people who live in a particular community. And they're not good plans, they're not bad plans. I've looked at them for the first time in this case because they're not something that's available in the outside world. But he sent me some details on the two plans. I guess there's a high and a low. One plan off the top of my head is about $165 a month. The other plan's about $190 a month. And he said, which one should we go with? And they both have some extras. They both have, a little dental, a little vision, a little hearing aid coverage. All well and good. But I asked him if they need any of that. She's got macular degeneration. She's in her late 80s, so she's probably not going to have a lot of dental work done. Hearing aids, she's already got them. So he asked me my opinion, and my opinion was this. If you're already going to pay $175 a month or $200 or $190 a month for an Advantage plan that has copays, and I think he told me the max out of pocket on the plan's like $3,500, why not pay $225 or thereabouts and just get a supplement? Just get a traditional Medigap plan. And he said, well, why would I do that? He said, our copays haven't been bad. She goes to the podiatrist and it's $45-50. And I said, because it would be free. And if you're paying $194 a month, and then you add in your $50 copay for the podiatrist, now you could have had a supplement plan or a Medigap plan for the same cost that month. The most important thing about the Medigap plans, they have no network. If the provider takes Medicare, they take it. So I don't know for sure if the facility promises that if you're in one of their plans, everybody who comes in takes that plan. Would make sense to me, but I don't know if that's the case or not. So what I told him is, why bother for $225 a month as opposed to $194, which is the one he was leaning towards? Just be able to see any doctor. Have no copays. Forget about all this aggravation. And finally, what I told him, I said, if it was my mother, I'd put her on the Medigap plan. I wouldn't be bothered with these Advantage plans that are unique to this facility. Just put her on the Medigap plan. You'll never have to think about it again. Every year, it's the same. You pay the premium every month and you're done. And the affordability of the premium is not an issue. So in this case, I said if it was my mom, I'd put her on a Medigap plan and not bother with the Advantage plan. But, that's definitely a consideration when you're looking at all the options that are available. Sometimes for a few dollars more, you have a lot less aggravation, no carrier in the mix denying claims. Not that may or may not happen, but why bother with it? Why take the chance? Spend the $225, get the Medigap plan, and be done. So have a great weekend, everyone. Take care. Feel free to message, comment, give you a little view of the Applegate Farm, I believe it's called. And I'm the only one here. So I'm going before it gets dark. Be well, stay safe, enjoy the snow, take care.